Ernie Garcia, internal medicine and sleep specialist here at Freeman Clinic of Internal Medicine in Alexandria, Louisiana. October is Breast Cancer Awareness Month, so let's hear from Dr. Blaine Broussard and his patient Angie and hear her story. Thanks for watching.
Breast cancer is more common than we would like. It is around 1 in every 8 to 1 in every 10 women will have the possibility of having breast cancer in their lifetime. It is the second most common cancer that is fatal to women behind lung cancer. It is the most common cancer that is diagnosed in women.
No, it wasn't. I consider myself to be a very healthy person, and nothing ever happens to me, so I wasn't expecting it at all.
The guidelines as far as screening for breast cancer vary depending on the organization that you read. And around 4 to 5 years ago, there was a very politically charged change in women ages 40 to 50. It also depends on the patient and the risk factors. Generally, starting at age 40, with no real risk factors being, there's no significant family history of breast cancer and no other things that would put them at increased risk, such as smoking or excessive hormone therapy and things like that. You have a discussion with the patient, individualize their screening appropriate to them, but typically age 40 is when you start screening with mammograms. Do that either every year or every other year, and by age 50, you're doing it every year.
Sadly, that answer is yes and no. Insurance drives that bus, so because of my age, I was only allowed one every 2 years. And because of that, I put it off. I assumed I had no family history, I had no reason to be concerned with it, so I was going on my 3rd year before I went. I just didn't find it as something that was eminently needed for me. I didn't have any family history.
So Angie first came to see me in May of 2016, and that visit was kind of just establish and get to know you. She had a few minor complaints at that time that we addressed appropriately. During that visit, and usually typically when I first establish with a patient, I will mention screenings for cancer, immunizations and things like that as okay, this is something we either need to take care of now or we need to take care of it in the very near future. We had a plan to, at her convenience, start working on the preventative care. Later that summer, we then decided to go ahead and do the screening for breast cancer specifically, and she had a mammogram that then showed suspicious lesions, and that's when her diagnosis started.
It was actually the day of my regular exam. I was in the shower, I found the lump myself, and when I got to the cancer center and they did the mammogram, they then sent me for a diagnostic and then a biopsy, and it was just like a whirlwind. Time seemed to just speed through.
So when she had her mammogram, we found suspicious lesions on the left side, 2 lesions specifically. At that time, the next thing we needed to do was figure out what these lesions were. So we referred her to an appropriate surgeon who then performed a biopsy of those lesions and also performed what's called a sentinel node biopsy. That's fancy for seeing if the cancer is spread to the immediate areas. It was positive for breast cancer, and at that time she was then referred to an oncologist for treatment of the breast cancer.
Oh, absolutely. Had it not been for Dr. Broussard and his staff, I would have lost my sanity. I called on them sometimes on a daily basis, and they always made me feel like I was a priority.
Typically, I will run across hesitancy in 2 specific populations. One are those that feel like they're too old, quote unquote, to be screened. Others that feel like they may be too young to get screened. It's the ones in the middle that really have no problem with it, because honestly, there's been a lot of good publicity about breast cancer screening in the past several years, so most of the patients are very well on board with it. The ones that are too old, the way I approach that is, you're most likely not too old and you're probably pretty functional. So if we catch something early enough, then we can continue having a good quality of life. The ones that are too young, again, that's a patient-specific way you screen, and so you have a discussion that would be tailored specifically to them and their wishes and desires.
The treatment made me pretty sick, and it was rough. But probably the hardest part, other than the physical, was realizing every time my family was around how scared they were and how unsure they were.
My advice would be specifically talk to your physician. Just express the reasons that you're not sure about getting the screening. And ultimately, I think it's a good idea to get screened because I've seen so many cases where women who were perfectly without symptoms, just going along doing their normal thing in life, and then you find something and thankfully find it early enough, and not thankfully that you found it, but you find it early enough that you can actually intervene and really not have a bad outcome and a bad event because screening wasn't done properly.
There's been such an outpouring of support. You have cancer survivor groups, you have the different ones at the hospital. They are so upbeat. Those people are always in the best of moods. They don't allow you to get yourself down. Early detection is the key. Get your mammogram. It took 10 minutes, but it probably saved my life. And had it not been for the attentiveness at Freeman Clinic and them pushing me, I wouldn't be able to call myself a survivor. I feel great.
Angie is doing quite well. She is now a year into the breast cancer diagnosis. She's had surgery, she's undergone radiation and chemotherapy, not without bumps along the road. She is doing well. Spoke to her recently, and she seems to be enjoying life and enjoying her family.
We'd like to thank Dr. Broussard and Angie for joining us today. If you need to get screened, please make sure you contact your primary care provider. If you don't have a primary care provider, we'd be more than happy to help you here at Freeman Clinic, so give the office a call. Thanks for watching.